Good day. We are Group 5 presenting shoulder girdle. As we all know, shoulder girdle or pectoral girdle is the set of bones in the appendicular skeleton which connects to the arm on each sides, and also it consists of the clavicle, scapula, and the humerus. It is important for us to move our shoulder, and that in this picture we can see the whole picture of this shoulder girdle, which is also called the pectoral girdle. And here it is located the clavicle, humerus, and the scapula. The clavicle is also called as the collarbone, which is an S-shaped long bone that connects the upper limb to the trunk. And the other one, the humerus, is that forms a ball and socket joint with the glenoid cavity on the scapula. The scapula is the shoulder blade, triangular flat bone located in the upper back overlying the second until to the 6th or 70th ribs. And these are the movements that involves the shoulder girdle. Retraction pulls the scapula back towards the rib cage. Protraction moves the scapula forward away from the rib cage and spine. Elevation allows the shoulder girdle to move upward. Depression, a reverse of the elevation movement, and downward rotation, rotating the lower scapula towards the rib cage.
The muscles of the shoulder girdle are classified based on their location on the trunk. There are 3 major muscles positioned at the anterior thorax, whereas there are also 3 major muscles positioned at the posterior thorax. The anterior muscles are namely subclavius, pectoralis minor, and serratus anterior. On the other hand, the posterior muscles are the levator scapulae, rhomboids, and trapezius. Look at this illustration. The upper portion is the subclavius. This muscle is a short triangular muscle of the thoracic wall that lies underneath the clavicle. It originates from the first rib and courses laterally to insert on the inferior surface of the clavicle. The pull of this muscle, which is slightly downward and strongly toward the sternum, suggests that its primary function is to stabilize the sternoclavicular articulation. Also, its position has something to do with the depression of the scapula. Second, the pectoralis minor. Well, you cannot see the pectoralis major in this illustration. It's because pectoralis minor is deep only to the pectoralis major. This muscle arises as 3 separate heads from the anterior surfaces of the ribs 2 to 4 or ribs 3 to 5. This muscle extends superolaterally to form a flat tendon, which inserts into the medial border and coracoid process of scapula. Pectoralis minor participates in several movements of the scapula, such as the downward rotation, anterior tilt, depression, and the combined movements of abduction and lateral lift. When the scapulae are stabilized by the adductors, the contraction of this muscle elevates the ribs where it originates. And even without contraction, it still exerts a slight upward and outward pull on these ribs. Therefore, this muscle contributes to inhalation and good chest posture. The third one is the serratus anterior. This muscle looks like a fan and is located at the lateral wall of the thorax. Its main part lies deep under the scapula and the pectoral muscles. It originates on the top lateral surface of the 8 or 9 upper ribs. and it inserts at the interior surface of the front border of the scapula. This muscle is divided into three parts: the upper, the middle, and the lower portion. The upper portion, which consists of the first to second rib, causes abduction and lateral tilt, or the protraction of the scapula close to the ribs. Combining with the activity of the trapezius, the serratus anterior muscle supports the upward rotation of the scapula. The lower trapezius is more active during abduction, while the serratus anterior is more active during flexion. This muscle also assists with inhalation. Let's move on to the posterior muscles of the shoulder girdle. Levator scapulae is a long and slender muscle that anatomically belongs to the muscles of the neck or the back. However, functionally, it is considered as a muscle that moves the shoulder girdle. It extends from the transverse processes of the vertebrae C1 to C4 to the medial border of the scapula. This muscle also causes elevation and downward rotation of the scapula, especially when the trunk is in the erect position. The weight of the arm at the acromial end of the scapula pulls that end down at the same time that the levator scapulae is lifting the medial angle. These two forces combined act as a force which rotates the scapula. Next one, the rhomboids. The rhomboid muscles are bilateral, the two bilateral superficial muscles. This consists of two functionally similar muscles called the rhomboid minor and the rhomboid major. These muscles extend from the thoracic vertebrae T2 to T5 to the medial border of scapula. They cause downward rotation, adduction, and elevation of the scapula. The rhomboids are also most active with the middle trapezius in stabilizing the scapula during the abduction of the arm. Their cooperative action with trapezius 3 is an important factor in the maintenance of a good shoulder posture. When the activity of these rhomboids is low or deficient, it would affect the functions of the pectoralis minor and serratus anterior, which causes the habitually abducted and tilted scapulae or having round shoulders. This leads to the failure of the pec minor and serratus anterior to hold the chest in good posture. Lastly, the trapezius. This is a large triangular paired muscle, and when viewed together, these pair forms a diamond or trapezoid shape. This muscle has many attachment points, as you can see, extending from the skull and spinal column to the shoulder girdle. It inserts to the medial border of the scapula, and while it is large and listed as a muscle of the back, trapezius is largely involved in movements of the shoulder girdle. Some anatomists treat the muscle in three parts. However, it is more accurate to consider the muscle into four parts. Parts 1 and 2, the upper trapezius. Part 3, the middle, and the part 4 is the lower. The upper portion, parts 1 and 2, shows the greatest activity in terms of elevation. The middle and lower portions are most active in adduction or retraction of the scapula. The greatest activity of the muscle, of the whole muscle, is seen in the upward rotation of the scapula, accompanying abduction of the humerus. During this activity, the lower two-thirds of the trapezius is the most active. And during flexion of the humerus, the lower third is the most active.
So the tendons are connective tissues that attach muscle to bone. And for the shoulder girdle, there are two sets of tendons that are here, namely proximal biceps tendon that connects the biceps muscle to shoulder joint in two locations. We're going to talk about that much later. And the second set would be the rotator cuff tendons. They cover the head of the humerus, the upper arm bone. They help you raise. It's generally they help you raise and rotate your arm, and they're made up of four distinct muscles, namely supraspinatus, infraspinatus, teres minor, and subscapularis. That's some tongue twister or whatever. Okay, so the proximal biceps tendon, they connect the biceps muscle to the shoulder joint in two locations. Over here, you can see that the biceps, I don't have biceps, so this is gonna be hard. Anyways, this I don't have biceps, but over here, that's the biceps. Okay, so right over here, the muscle that you see is the biceps, and they connect to the shoulder joint by the proximal biceps tendon, because there's two kinds of tendons that you can see when it comes to the humerus, and that's the one over here and the one over here. But for the shoulder girdle, we're gonna there's the proximal biceps tendon, and they connect to 2 points. First is the coracoid process, and the one over the one on the left part. Yeah, okay, so the ones that has like the protruding bone over here as the coracoid process, and the other tendon connects to the humerus head. So over here, the glenoid cavity. That's the two locations where the tendons connect. And then the second set of tendons that you can see in your shoulder girdle would be the rotator cuff tendons. Like I said, the rotator cuff is a collective term for 4 distinct muscles. Just this. Okay. Again, rotator cuff is the collective term for 4 distinct muscles and their tendons, which provides strength and stability during shoulder movement. It's collective term, and basically a layman's term for this the muscles and tendons over here. That's why you can rotate. It's called rotator cuff for a reason, because you can rotate your arm because of them, and they're made up of 4 distinct muscles and their tendons, so it's really a combination. And those 4 distinct muscles are, once again, I'm gonna tongue twist again: supraspinatus, infraspinatus, and the subscapularis, and the teres minor. So over here we have the anterior, or the front view, anterior front view. And when it comes to front view, you could this one muscle is the subscapularis, and over here at the back, well, you could also see the supraspinatus over here for the front, but mostly it's at the back, just as the infraspinatus and the teres minor. They're at the back, so we can talk about that later. So the supraspinatus, let me just move this again, and forgive me for the noise. The supraspinatus, that's basically it's over here. This is abduction of the arm and stabilization of the humerus head during arm movements. So abduction is moving away from the medial location. So It's just like, you know, raising arms sidewards. That's the abduction, and you could do that through your muscle over here. Cool. Okay. Next, the infraspinatus. It's located at the back of the shoulder. See, you didn't see any infraspinatus at the anterior part because they're at the back. Okay, and they aid in stability and rotating the arm to the side. So it how do you do this? It just goes to the side, lateral rotation. Side means lateral side, and that's, excuse me. So they're here, like there's 3, and they help you move your arm to the side. Are we cool? Okay. The third will not yes, okay. I'm sorry. I have the sniffles. Okay. So the third tendon would be the subscapularis. It basically like at the back. I mean, as the name suggests, scapula. It's in the scapula. Like, okay. I mean, it's in the scapula, like anterior part over here. So it's the only internal rotator of all the rotator cuff muscles, like inwards. I mean, yeah, so it goes like this. I am demonstrating, I'm sorry, it was weird. It's in the adduction of the arm, so it's basically an opposite to the supraspinatus that I talked about earlier, because the supraspinatus, it goes like away from the medial, while the subscapularis, it when you go back to the middle, when you retreat, you know. And yeah, the internal rotation, like, you know, like how cats, like, you know, the figurines cats, yeah. And last but not the least, the teres minor or minor, I'm not really sure. I didn't search that, I'm sorry. The teres minor, the antagonist muscle to medial rotation. So before, this is the lateral, right? Like away from the to the side, and then you revert back, and that's your medial rotation. So when that happens, that's not the teres, rather it's the opposite muscle, since it's called antagonist. So the opposite muscle to the medial rotation, that's contracts. So it stabilizes the shoulder during medial rotation. That's why it's at the back. Okay, because when you do the medial rotation, what you're actually stretching are your muscles from the anterior part, and the opposite ones are from the back, and teres minor is at the back. Are we good? Okay, well, now that you know a little bit of the tendons, you're gonna go for ligaments. Okay. And these are let me just go back there. Here are the, yeah, I think we're done. Okay, now for the ligaments, resources. Okay, bye, have a good day. Oh my gosh. Wait, okay. Kami na ako dun, sorry, hindi ko na-stop. Okay, bye na talaga. Bye.
The third shoulder girdles are the ligaments. Ligaments are a dense of connective tissue that connects bone to bone. These ligaments are fairly short in comparison to the tendons, but they are very similar to what they are made of. Ligaments are tough and flexible and look like white band structure, as we can see in our screen. To withstand forces that it takes, these ligaments can be found in different directions, and it is made of weaving matrix of fibers. The ligaments in the shoulders are all named after the bones they are connected to. The clavicle has two ligaments involving the shoulders, which helps it to stabilize the nearby bony structures, namely the acromyoclavicular ligaments and the coracoclavicular ligaments. Shoulder blade or the scapula also have two ligaments, namely the coracohumeral ligaments and the glenohumeral ligaments. The humerus have one ligament, the coraacromial ligaments. The coracoclavicular ligaments serves to connect the clavicle and the coracoid process of the scapula, and it does not properly belong to this articulation, but it is usually described with it, since it forms a most efficient means of retaining the clavicle in contact with the acromyon. It consists of two fasciculi called the trapezoid and the conoid ligaments. The coracoclavicular ligament function is to strengthen lateral end of the clavicle by attaching it. It is attached below to the upper surface of the coracoid process and above to the oblique ridge on the undersurface of the clavicle. Its anterior border is free, and its posterior border is joined with the conoid ligament. The second ligament, as mentioned, is the acromyoclavicular ligament. Acromyoclavicular ligament is part of the acromyoclavicular joint that it is also divided into two parts. The superior acromyoclavicular and this superior acromyoclavicular connects the superior surface to the acromyon and the acromyal end of the clavicle. Similarly, the inferior acromyoclavicular ligament connects the inferior interface of the acromyon and the acromyal end of the clavicle. It is thinner than its superior counterpart and may perforate with age, and it is particularly important in individuals with non-congruent articular surfaces of acromyoclavicular ligament joint, as it provides an attachment point of the articular disc if it is present. So the main purpose of this ligament, the acromyoclavicular ligament, is also to strengthen the joint capsule. So the primary role of these two ligaments that can be found in our clavicle is to ensure that the clavicle moves anytime, and it moves with the scapula, so that whenever we are retracting or depressing or retracting our shoulders, our clavicle will move with the scapula through these two ligaments.
Hello, good evening. I am Melva Stayaban, and I will be continuing the report. Now let's proceed to coracohumeral ligaments. So this is located in the inferior surface of coracoid process, and its central portion is thicker than its peripheral. So this ligament plays a significant role as it supports majority of the weight on your arm. This ligament is responsible in preventing or limiting further movement of direction as it reaches its certain stretch point. Now, next is glenohumeral ligament. So glenohumeral wraps around the glenoid cavity and attached to the humerus. It helps stabilize the shoulder joint. As you can see, it wraps around the shoulder, wrapping it tightly, improving its stability of joint. Now under this, we have the superior, middle, and inferior glenohumeral ligament. This tree plays different role in stability of humeral head depending on arm position and degree of rotation. Now for our superior, this resists anterior translation of adducted arm. As for middle, it resists the anterior and posterior translation in the mid-range of arm adduction at 45 degrees and external rotation. And lastly, we have the inferior, which resists the anterior to inferior translation in 90 degrees adduction and external rotation. Under the inferior, we also have the anterior and posterior. Now for anterior, this is the weak link that predisposes to Burkhardt lesions. As for posterior, this resists the posterior to inferior translation in adduction and internal rotation. Next, we have the coracoacromial ligament. So this is only attached bone to bone and located in scapula. This ligament prevents superior disruption of humerus. So it prevents humerus here in some sort of pushing up through the top of the shoulder. It is a bit of our superior protection. Okay, that's the end of our report. Thank you for listening.